Thank you so much for being with us today on Joy in Our Town. We have a lot of joy for you today because we have a great, interesting young man with us. His name is Jonathan Lack, and he is the project manager, or perhaps you might consider him the director of Cardeo Healthcare Conference and Consumer Expo. Now that's a long title, a lot of information, but he's so smart, he's going to break it all up so we can understand it. And I'd like for you to just meet him. He's a great guy, Jonathan Lack.
Thank you very much.
Thank you so much for being with us today.
Thank you for having me.
You're very welcome. So tell us all about this activity that you have planned, and you need people to come out and take advantage of what's going on, right?
Absolutely. We're going to have a 4-day event, February 12th through 15th at the Reliance Center.
4 whole days?
4 days. The first 2 days are for medical professionals and allied health professionals, doctors, nurses, primary care physicians, occupational therapists, cardiologists, and they're going to learn about the latest advances in heart disease, the latest debates on who pays for health care. That's a big issue of the financing of our health care. And then how do we track the results? So how do we know that our patients and our doctors are doing a good job with each of the responsibilities that they have?
Okay.
And then after the healthcare conference, we're going to have a 2-day health expo, free to the public, on Saturday and Sunday, Valentine's Day weekend. And we're going to be offering educational seminars and free testing in a variety of different areas for kids, for adults, and for seniors.
Okay. And so this is all free?
It's free. We believe that it's important that we start learning about heart disease and other diseases that will be represented there as young as possible. Prevention before intervention is our tagline, and we think that if kids start early, then working on nutrition and exercise, that's a good start. We have an obesity epidemic among our youth today with higher incidences of diabetes, which leads to heart disease.
Okay.
And we want to contribute to altering that.
Sure.
And then we want to make sure that our adults who eat out more, you know, Houston has a bad reputation of being one of the fattest cities in the country. We don't accept that.
Right.
We're proud Houstonians, and we think we're getting a bum rap.
Okay.
And we'd like all of our neighbors from all across the city, as Bill White says, the new mayor, we need to reach out to neighbors everywhere. And we want them to come down and prove to the country that we do care about our health, our individual health, and your health, and our neighbors' health across town.
Right.
So we're doing different seminars. We're going to have seminars focused on women, issues that are unique to women, issues that are unique for diet. We're going to have cooking seminars on both Saturday and Sunday.
That's nice.
With chefs there from...
So will people actually be able to taste these healthy menus that they prepare?
Well, we're deciding on, rather than tasting it, we want them to leave thinking about how to do it at their house.
Okay.
We're not going to cook fancy foods that everyone eats maybe once a year.
Right.
We're going to have our chefs from Alexander's and from Trevisio's cook everyday food.
Right,
because the everyday food is what's killing us.
Yeah.
So every year there's 250,000 Americans who die of heart disease. And many of them, it is the first symptom is the last symptom. And so we want people to leave to think about what are they eating at home.
Right.
When you go to a restaurant, many restaurants tell you what's healthy. But it's up to you and to me when we go to the grocery stores to buy our food, and when we come home and cook it for our kids or our loved ones, to think about the ingredients. So the emphasis is going to be on that at the cooking. We're going to have nutritionists from the University of Texas Health Science, and they're going to work with the chefs and say, you know, if you were making chicken fried steak and if you just changed this ingredient, you would lower the cholesterol.
Right.
Or if you were cooking a pasta dish, if you may have changed this ingredient.
Yeah.
So you're going to leave
small
thinking.
Little changes, but it'll still taste good.
It's certainly, we hope it'll still taste good, otherwise you won't continue to do it.
Exactly.
We're going to have a radio program. Dr. Ken Cooper is coming, and he's the grandfather of aerobics.
Oh, he is.
And so we're going to have kids from HISD and from YMCA and any other youth group that wants to come on Saturday morning from 9 to 11 to come listen to him in a panel with a local doctor, Dr. Jeffrey Ross, who is he's a podiatrist and he's a sports doctor, and he is a big advocate in Houston for kids' health and preventative care. He sits on the governor's Fitness Council and the State Board of Diabetes. So he'll be on the program, and we're going to work with the kids to have them leave feeling better about what they do every day.
Okay, good. Now, a while back, you were talking about youngsters.
Yes.
And heart disease. Now, they're going to be given some instructions about how to eat differently. Am I remembering correctly?
Well, the first thing we want to do with the kids is emphasize the importance of exercise.
Okay.
You don't have to be a superstar in the NBA or WNBA to exercise. Everybody needs to exercise.
Right.
You can be a chess player or a violin player. You still need to exercise. So we want to emphasize that. And we want to emphasize the basic food ingredients for these kids. So they'll think about what they're eating and why is it important when their mother says to eat greens. Well, is it because their mother's just telling them what to do, or is it because she loves the child and really wants to emphasize that you need those types of vitamins?
Okay, so they're going to be motivated to improve their choice of food.
Right. Why do we eat fruits?
Yeah.
Why do we eat vegetables? Why do we eat fish? Why? Just because somebody told me, or because it really is going to have an impact? So we want them to take responsibility for their own health and understand that they do have choices.
Now, would this also be a panel?
It'll be a panel, absolutely. It's going to be that'll be in the morning, and then we'll have the panel for the adults in the afternoon with the cooking chefs.
That's good.
And then we're going to also have programs for seniors.
Oh, okay.
Lifestyle programs. We're working with the Jewish Community Center is reaching out to other senior groups around town. The Asian community, the African American community, the Hispanic community, and they're working with the county, and they're going to have county buses that are going to go to the senior centers, pick up seniors, and bring them to the Reliance Center on both Saturday and Sunday.
Okay.
And they're going to have seminars on depression, on lifestyle, what's the proper diet for someone who is older. They're going to do some Tai Chi exercises, walking seminars, so that even, it's never too late to take care of yourself, whether it's your diet or your exercise.
Okay.
And so that's everybody, all ages, all genders, everybody of whatever background they are in Houston is most welcome at this event.
Okay. Now, all of these seminars are taking place. Are they staggered? So if you're talking to the children about their eating patterns, is anything else going on, or will everybody, including children, be there? Or while the children are there, will the
We're going to have some congruent seminars.
Adults be
That's right.
Some what seminars?
Some seminars going on at the same time.
Okay.
So because we have so much, what we have done is worked with a number of wonderful healthcare not-for-profit organizations in town that are going to be offering different types of seminars and testing.
Okay.
So we want each of them to have a chance to provide the services that they do best and get exposure.
Right.
So we're working with the blood bank to do a blood drive.
Right.
We're going to work with the American Red Cross. They're going to do some seminars.
Okay.
The Lupus Foundation will be there.
Okay.
MD Anderson Educational Center will be there. Methodist Wellness Center will be there.
Sure.
Memorial Herman's
You
Wellness
didn't leave
Center.
anybody out, did you?
Everybody is invited. Every healthcare institution in Houston
That's
is
beautiful.
welcome to attend. We had two rules when we started this project, two goals. We were going to be institutionally agnostic. Every institution could come to participate, and we were going to be citywide inclusive. Nobody is going to be left out and say they couldn't be invited. So
Very good.
we're excited about it, very excited about it.
Right. So it sounds to me as though I can be there. And it'll be something going on all
the day. 9 to 6.
I can go from one event
That's right.
to another. And
Some will
that's
be
what I
repeating.
wanted to convey to our viewers.
Yes, ma'am. Some of the seminars will be repeating.
Okay.
And so if you miss one while you're at the kids' event, you can go to it afterwards.
Okay, good.
We're going to be meeting from 9 to 6 on Saturday at the Reliance Center and on 9 to 4 on Sunday at the Reliance Center. So if you're working on Saturday, you can come down on Sunday. If you can't come on Sunday, you can come on Saturday. If you have a great time on Saturday, you can come both days.
You can come back.
That's right.
Exactly. And so even if someone is giving blood, they can do that, and then they can go and
do other types of
benefit
testing
from the other.
and attend the seminars.
Okay.
And really, you know, mind, body, and spirit on Valentine's Day weekend, it'll be a wonderful thing for people to give blood on Valentine's Day, to take care of themselves also. You give blood for other people, but
never know when you might need
That's
it.
right, and you do testing for yourself, and you do testing to set an example for your kids and for your siblings or your relatives, that if we individually set the example on taking care of ourselves, we'll have an impact.
That's right.
On somebody
now, we
else.
don't have much time left, but you did mention organ donations earlier. So you want to get people interested in understanding the need
the
for
importance
that?
of it. The Living Bank, which is a wonderful organization, we don't have a state registry for organ donors. So the Living Bank is trying to work with the state to donate, actually, the software for the state for free to the state, so that those of us who want to donate organs, if a tragedy happens to us, we could be giving life, extending life to somebody else.
That's right.
So a lot of people don't know about that, and they're going to be there educating folks and making them feel more comfortable of certain fears or stereotypes of what donating an organ really means and what it doesn't mean. Right.
Okay. So some people, I think, plan on wearing their organs out. But there's always a little life left in them where somebody else can benefit.
And, you know, there's an old Talmudic Babylonian saying, to save a life is to save the world.
All right.
And any of us that can do that, it would be a wonderful thing for all of us.
Exactly right. You've done a great job. Didn't I tell you Jonathan would do a great job? I knew that you would. Let me let our viewers know how they can obtain additional information. Of course, we're talking with Jonathan Lack, and he is very well representing Cardeo Healthcare Conference and Consumer Expo that's coming up very soon. The address for additional information is 3410 West Dallas here in Houston, and the zip code is 77019. The telephone number is 713-521-4122. That's 713-521-4122. The web address is www.cardeo.com. www.cardeo.com. Jonathan, thank you so much for being with us. You did a great job. I knew you would.
Thank you so much.
You are so very welcome. And thank you, our viewers, for being with us. As always, we need to take a brief break, and then we'll be right back with much, much more joy in our town for you. So whatever you do, don't go away. Stay with us for much more joy in our town.